Should you brush your teeth after every meal? I'm Rick Buck, and I've been a dentist for 14 years, so subscribe if you have teeth and care about your health. In this video, I will show you what happens to your oral health when you brush after every meal. I will also go over the pros and cons of brushing after every meal. Now to start off, I stain my plaque a pink color as I always do. Then I brush and I floss my teeth using my favorite brush and especially my favorite floss. But first, let's pause to look at how much plaque is there before I brush my teeth. This is important because the main reason you would brush after every meal is to reduce the plaque buildup. And so if it's doing it well, you'll see less plaque before I brush every time and each time I brush during the day. You would want to do this because you want to keep the plaque levels under control, because if that plaque builds up, then that is what ultimately causes gum disease and cavities. Now, that plaque isn't necessarily always bad, which is another topic I will cover and have covered in another video. But for this video, we will assume it is bad, because for most people that eat sugar and lots of carbs, it likely is bad bacteria that is in that plaque at least. Now let's look at the results after brushing after my first meal. You can see that my teeth are pretty much spotless and free of plaque at this point. Watch my video that I will link to at the end of this video to see how to get your teeth this clean every time you brush. So now let's skip forward a few hours, and now you can see that I'm going to stain my teeth after lunch, but before I brush, and this is how much plaque builds up in those few hours. The plaque is not that much, and certainly not as much plaque buildup as usual like we saw before the first time I brushed previously. And at that point, I hadn't brushed for 24 hours. This has only been a few hours. So let's start brushing and cleaning them again. Now today, in this video, we're following the amount of plaque buildup, but there are other microscopic reasons to brush or to not brush your teeth right after eating every meal. For this, you quickly must understand what happens in that plaque and your mouth when you eat. Let me explain. Your tooth is made up of a lot of minerals that contribute to how hard the tooth enamel is. Now, when you eat food, the bacteria in that plaque on your teeth also eat your food. Only the bacteria produces an acid that demineralizes your tooth surface, and especially right where the plaque adheres to the tooth. So it takes away those minerals that make the tooth strong. This demineralization is what turns your tooth into a soft and weak state that is eventually what causes cavities. The good thing is that about 30 minutes after your meal, your saliva has replenished the minerals for your tooth and remineralizes it to become hard again, as long as the plaque isn't blocking it from doing so. But brushing right after, and if you use fluoridated toothpaste, the fluoride is a stronger mineral and it remineralizes the tooth even further than the enamel initially was with its more natural minerals to the tooth. So that's why you use fluoride after the meal. So you're constantly strengthening the tooth more when it remineralizes with fluoride. Hopefully that makes sense. But before I go on and explain more, let's stop and look at the results of this brushing. You can see that we have the teeth spotless from plaque again. And so now that we've looked at that, let's jump again a few hours later to after dinner, but before I brush after dinner, where I stain my plaque right before I brush. Now you can see the plaque buildup is getting less and less every time because I've brushed away more and more plaque, and it has less of a starting point to colonize with if I'm removing more plaque, especially more plaque from smaller colonies. So once again, this means the plaque is having a harder time recolonizing and growing when I brush after every meal, possibly because less plaque is there to begin with. So you may be thinking, great, that's what I have to do to stop cavities in my mouth. You may be right, but first let me finish my earlier thought. You see, toothbrushes and toothpastes are surprisingly abrasive. How abrasive toothpastes are is recorded and published from time to time in this study. But if you're using an abrasive toothbrush and toothpaste and you're too aggressive in trying to take care of your teeth, it will eventually cause gum recession. And now that the roots of your teeth are exposed, then it will further cause abrasion and notching that will often occur on people's teeth. And this is very common for people that think they are taking great care of their teeth. As a dentist, I can tell you, surprisingly, this this happens a lot, this notching that they get? Well, the issue is that if you brush during this demineralized state, that abrasive toothpaste you use will likely thin your enamel and your roots a lot faster. Now, it still takes a while for this to happen, but ultimately it can be unsightly and cause a lot of tooth sensitivity and pain for some people. Okay, now fortunately, the abrasiveness for most toothpaste have been studied and given a score called an RDA score. And the lower the RDA score, the better. Most whitening toothpastes are terrible and very high on this scale. So the first thing to do is to use a toothpaste that is not abrasive. Sensodyne Pro Enamel toothpaste and my favorite dental product website, I have linked to below this video, sell a very non-abrasive toothpaste. So you don't have to worry as much with this problem, but you still have to brush lightly. Okay, before I go on more, we shall pause and see the results of how well we clean, and we can see we are virtually spotless again and clear of plaque. Okay, so the next morning when we look at the plaque, this is the most important time that I want to look at, because this plaque buildup should be less, a lot less, hopefully, than the plaque buildup that I started out with, which is when I hadn't brushed for 24 hours. So we're gonna see how well brushing my teeth after every meal does in eliminating plaque buildup, and especially eliminating future plaque buildup. Okay, so now when I'm looking at the plaque, it's been 12 hours between brushing. You can see the plaque has barely recolonized, especially when we compare the results to when we started not brushing after 24 hours the day before. Now let's look at all 4 starting plaque levels before each time I brushed throughout this little experiment. The top left was my plaque level not brushing for 24 hours. The top right is before brushing after lunch, the bottom left is before brushing after dinner, and the bottom right is my final plaque level after brushing after all the meals and doing this for 24 hours. You can see the plaque just doesn't colonize and recolonize your teeth much if you brush it away after every meal and you don't give it a chance to fuel up with the food that they eat, which is the food you eat. So there are 2 sides to this coin. On the one hand, you're at risk of wearing down your teeth according to studies, especially if you brush immediately after eating a lot of foods that are acidic themselves, like soda and citric acids. On the other hand, it's good because you have way less plaque brushing after every meal, which means you're even less likely to have cavities and gum disease and an acidic nature in your mouth, because those plaque aren't creating an acidic nature in your mouth. So with a lot less plaque buildup over time, it means you're less likely to get demineralization and less likely to get thinning of your enamel or the root surface of your teeth, because simply you have less plaque that causes the process to start. You may be thinking, great, what should I do? It depends. If you aren't prone to cavities and your diet doesn't consist of much sugar, then I would say brushing after every meal is overkill and can possibly do damage to your teeth. So just make sure you brush twice a day and floss well at least once. If you are prone to gum disease and cavities, then I say you can brush after every meal and it will be a great benefit to you, especially if you use a fluoridated toothpaste, which once again will remineralize your tooth to make it become even stronger. But if you do that, you want to take caution so it doesn't wear your teeth down over time. So here are some things you can do to prevent the wearing down of your enamel if you brush after each meal. First, use a soft toothbrush. An affiliate link to my favorite brush is below this video. Second, use a non-abrasive fluoridated toothpaste. Third, waiting a few minutes after your meal to brush is better. After 30 minutes, you should be completely fine, as your tooth will have remineralized. Unfortunately, it won't have remineralized with the fluoride. 4, if you don't want to wait 30 minutes, yet want the full effects of fluoridated remineralization right after your meal, then rinse with Act Fluoride Rinse right after your meal, and then brush a little bit later. 5, don't press too hard as you brush. If you follow those steps, you shouldn't wear down your teeth and you will get the plaque removal if you're brushing after every meal. Remember to watch my video on the best daily brushing and flossing routine so you can make sure you are cleaning your teeth as well as possible. Affiliate links to everything I talked about today are in the description below this YouTube video. Subscribe if you want to keep your teeth.